The people in all of these photos, West Michigan frontline workers, doctors, paramedics, nurses, all putting their lives on the line in the battle against COVID-19.
People getting intubated and passing away very quickly, it changed everything.
Nurse Jen Anderson says she wishes people could see what she sees every day in the emergency department at Ascension Borges Hospital in Kalamazoo.
I don't know if people really understand what it's like to hold an iPad up to somebody that you barely know so that they can say goodbye to their loved one across the country, because there's no chance that they would ever get to see them again.
It's a fear she says frontline workers face at the start and end of every shift. For Jen, she kisses her dogs goodbye before she goes to work, while some of her coworkers leave their kids only to go home to worry about their health and potential exposure to the deadly virus.
They go home and they shower for a half an hour and then go kiss their kids goodnight if their kid's going to wake up in a few days with a cough and if they're going to contract it.
More than 700 people who work at Spectrum Health's hospitals in West Michigan have tested positive for COVID-19.
I just couldn't catch my breath. It was like no matter what I did, tried different positions, tried sitting, and it was just like this heaviness of man, I cannot breathe.
At 28 with no underlying health conditions, a Grand Rapids ER doctor says he thought he'd be fine if he got COVID-19. But he was wrong.
I think the hard thing is having seen it and having been the person that talks to the patient with COVID and says, you know what, it's time to call your wife. We're going to have to put a breathing tube down and it's time for you to say goodbye.
Suddenly, Dr. David Burkhardt was the patient, lying in the same unit, struggling to breathe. Weeks after his diagnosis, the avid runner is still catching his breath, anxiously waiting to go back to work. He says he doesn't know where or how he contracted the virus. He took precautions outside of work and wore protective equipment in the ER.
Anybody caring for patients has a medical grade mask, eye protection, and those going in the COVID areas have face shields as well.
Bronson Methodist Hospital's director of nursing says hospitals have been conserving personal protective equipment since the start of the pandemic, preparing for a second wave.
We come in the room looking like monsters with respirators and face shields and gowns on, and it breaks my heart when little kids are in there.
Now, COVID-19 cases are surging across the state, and hospitals in West Michigan are at or nearing capacity.
This is our war and this is our battle, and we're going to get through it. We're going to get through it together. But we need everybody, even not healthcare providers, to be a part of this.
Bronson has a critical incident stress management team to help frontline workers mentally recharge and respite rooms to help them unplug and decompress. Head to our website, www.mt.com, for a behind-the-scenes look at that. For now, in Kalamazoo, Callie Rainey, News Channel 3.